webinar is brought to you by the Council of State Governments, Justice Center, Criminal Justice Mental Health Consensus Project. Today we'll be talking about measuring program performance in mental health courts. The webinar is made possible to the field through the support of the Bureau of Justice Assistance, Office of Justice Programs, U.S. Department of Justice, as part of its funding through the Justice Mental Health Collaboration Program. Today's presentation will feature Drs. Greg Cheeseman and Nicole Waters from the National Center for State Courts, presenting on the Center's newly released mental health court performance measures. These measures were piloted in 4 sites around the country, and we're lucky today to have Lynn Fenton from one of these sites at the Superior Court of California, County of Orange, on to tell us today about her court's experience trying the measures out this spring. My name is Hallie Fader-Tao, and as the court policy analyst at the Criminal Justice Mental Health Consensus Project at the Justice Center, I'll be providing some context for this project based on our work as technical assistance provider for BJA's Justice and Mental Health Collaboration Program. At the end of the presentation, there will be time for a question and answer session. To ask a question, please type the question into the Q&A panel at the bottom right hand of your screen. We'll do our best to answer your questions. If your question does not get answered during the webinar, please follow up by email after the event has ended. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support directly at 1-866-229-3239. Please understand that there are some technical issues you may not be able to resolve. For this reason, we're recording this event and we'll be emailing the recording to all the attendees. The final recording will also be posted online along with the slides at consensusproject.org. Before we begin, I just wanted to give a quick introduction to the Council of State Governments Justice Center. We're a national nonprofit organization that's made up of member states, all 3 branches. The Justice Center has a number of projects going on. The one that we're working on today is the Criminal Justice Mental Health Consensus Project. Some of the main activities of the Consensus Project are providing training and technical assistance for states, counties, and municipalities across the country working on collaborative criminal justice and mental health programs. In that context, today's webinar is offered to help provide mental health court practitioners and policymakers with understanding to be able to describe how performance measurement fits into program design, operation, and sustainability. To understand how the National Center for State Courts performance measures were developed and how implementation of these measures works for mental health courts. Also, to identify factors for selecting appropriate performance measures for your program. If you're running a program, working on a program, or advising a program today, you're most likely being told about the importance of data collection and analysis. And if you signed up for our webinar today, you've believed it at some level, and you're trying to do something about it. With data-driven in our mission statement, Sean, I'm seeing the slides have gone away.
They haven't on my screen, Hallie.
Oh, okay, great. Then I'll keep talking.
Which slide are you supposed to be on?
I'm supposed to be on slide 5.
Oh, they haven't been advancing then. The introduction to the Justice Center, you're past the learning objectives.
Yep.
Okay.
I think keep talking, and if you can just advance on that would be great.
Okay, doke.
Thank you. And again, I apologize, everyone, for it seems like I'm not as connected as I should be.
Here, Hallie, actually, I think you should be able to control it now.
No, I can't see the middle. It's fine. I'll just tell you once I advance.
Okay, that's fine.
So we should be on slide 5, and we're looking at a framework for mental health court data collection. And the reason I wanted to put this up here before Nicole and Fred speak is just to give a little bit of context for where performance measurement fits in the type of data collection that you all are doing and the thinking that you're doing about collecting data, measuring your court's performance, and evaluating your court's performance. Each of these components in the outside circles is a question that helps inform how, why, what data you're collecting, and will inform, so why are you collecting data? Well, you're thinking about sustainability, maybe you're thinking about management, or maybe somebody's telling you you need to. What data should you collect? Well, these are the fields that you're thinking about, and how should you collect the data? Is there a certain person who's responsible for collecting it? Is it collected in paper files and an Excel sheet through some management information system? And as your program or as your team is thinking about each of these three data questions and the answers to these three questions inform each other, it's building a platform for the sort of reporting, evaluation, or performance measurement that your program is going to be doing. Sean, can you click through by now so that all three circles should be showing and the center circle is also showing?
I have.
And great. And then so can we move over to slide 6?
All right.
We have a lot of resources available for you in terms of the three questions on the outside. I've just put in a little bit of a link here to webinars that we have online at consensusproject.org. The first two parts of our data collection for mental health court practitioners answer some of those questions. There's the written practitioner guide by Henry Stedman, a guide for collecting mental health court outcome data. And we also have an access database and data collection tool template for courts that are trying to answer these three questions. Today's focus, we're obviously working on that center circle. So the National Center for State Courts is going to be talking a little bit about the performance measurement piece, that sort of analysis and reporting that they've been working on. Can we advance to slide 7? I just wanted to provide here a recap for those of you who participated in data collection for mental health court practitioners, Part 2. This is going to look familiar. We talked about a bunch of different types of analysis, starting from the bottom, the cost-benefit analysis that we've all heard so much about. We talked about process evaluations and outcome evaluations, which give you a sense of whether your program is working the way that you thought it does, whether the process, whether people are flowing the way you thought they do, and whether you're achieving the outcomes that you just developed your program to achieve. Today's conversation, obviously, about performance measurements. Moving over to slide 8. This is a slide that's mostly for your notes. When you're revisiting these different types of analysis, after you've heard Fred and Nicole and Lynn talk about the National Center's performance measures, this is a little bit of an at-a-glance comparing who does the different types of analysis, the expertise level required, and how frequently. But the main takeaway here is that performance measurements are really something that's done by the team for the team in a certain sense, that it's not, you don't need a statistics degree or research expertise in order to collect performance measures, and it should be something that's a regular part of your program's management and operation. All right, I'm going to turn the phone over right now to Fred Cheeseman from the National Center for State Courts to talk a little bit about the performance measures their program has designed.
Thank you very much for that interesting introduction, Hallie, and I'll try to build on some of the concepts that Hallie introduced. But the first thing that I want to do is to go over the results from those polling questions that we asked you all when you signed on to the webinar. These questions were designed to give us a better picture of our target audience, who is you. And we had 3 questions. The first question, are you currently collecting performance measure data? I'm astounded. There's 101 respondents to the poll before we cut it off, and 56% of you say that you're collecting performance measure data. And I think you should all give yourselves a big hand. I'm surprised and pleasantly surprised and somewhat shocked. question, approximately how many participants in the program? Needless to say, almost all of you are in the 59 or less category, those two lower categories. And has your program been evaluated? About 24% of the people participating in this webinar work for a mental health course that's been evaluated. So I was expecting that. I'm really very pleasantly surprised at the percent of you that are collecting performance measure data. And I really would be curious if we asked that same question at the end of this webinar, what the response would be. But nonetheless, let's move on. And what I would like to do next is just talk a little bit about why are we doing performance measures for mental health courts. And this really ties in with our philosophy here at the National Center, which is that if you can't measure it, you can't manage it. Excuse me. And we certainly support, as does the Council of State Governments, effective and efficient management of all types of courts. And this project, just to put it in perspective, is just another example of the National Center's ongoing efforts to assist courts of all types to measure and manage their performance. Some of you may be familiar with some of our previous efforts in this area, which include the trial court performance standards, our court tools product, and hopefully some of you are familiar with the drug court performance measure work that I've done. Having said that, what I would like to do next is just go over 4 of the most important principles that guided us as we designed these measures. And the first principle was that these tools are designed to better manage and effectively administer individual mental health courts. So these tools are designed for you and your court. That's their primary purpose, to be used by individual mental health courts. Secondarily, we hope that the information generated by these performance measures will be of use to policymakers. And third, these measures were designed to be inclusive of the key issues that address the purpose of mental health courts, and that's both the criminal justice and the mental health needs of participants, while balancing the need to be inclusive of all key domains. And what you'll see is that these 14 core measures really quite naturally fall into a relatively small number of measurement domains. And we wanted to make sure that when we were designing our performance measurement system for mental health courts, that we were measuring performance in all of the measurement domains. You know, because sometimes it's easy to develop a set of performance measures that that concentrate on one measurement domain. For example, processing, where it's you might just be measuring time between events. That's kind of easy to do. But here we strove to address areas like participant accountability, treatment needs. So we're really attempting to achieve a balance with the mental health court performance measures. And fourth, we wanted to clearly distinguish performance measures from outcome/impact evaluation measures. And another word for impact is distal outcomes. Sometimes we talk about proximal and distal outcomes, but outcome is distal, which means, you know, sort of in the future outcomes. So we want to distinguish performance measures from outcome impact evaluation measures. And let me just deal with that issue right now. Outcome impact evaluations are really concerned with the value added by a program over some alternative. So, for example, we might talk about what is the value added by a mental health court over a business-as-usual alternative, which might be probation. What's the value added? That's a question for outcome impact evaluation. And let's just suppose that we detect some difference in performance between the mental health court and the business-as-usual alternative, probation. Let's say that the mental health court is shown to reduce recidivism of participants, which we hope it does. Then the question for the evaluator is, well, can I attribute this to the mental health court as opposed to some other possible explanation? So, for example, it may be that there's a difference in the average age of your mental health court participants and the business-as-usual alternative. alternative, which could explain the difference in recidivism. We want to rule all of these confounding, spurious explanations out so that you can attribute any favorable outcomes to the mental health court. So the point is that value added and attribution are big questions for outcomes/impact evaluations, and they're not at all important for performance measurement. The analogy that I always use when I talk about performance measurement is to think of the dashboard of a car, okay? Now, if you will, just kind of mentally visualize the dashboard of your car, okay? And what do you see? Well, you see a limited set of indicators, okay? You have the engine temperature, you might have RPM, some of the more recent cars you can check your air pressure on your car and stuff like this. But you have a gas gauge, you have a speedometer, you have this limited set of instruments, okay? Now these are your indicators of performance, okay? And one of the things that you notice is, look, there are many aspects to the performance of a car or a jet or anything else like that, but we only have a limited number of instruments that really focus on the key areas of performance, okay? So in this project, we started off with well over 30 candidate measures, and we, through a process of expert consultation and talking to people in mental health courts, we boiled it down to 14, okay? And these were carefully chosen to measure performance in critical areas of functioning. Okay. Now, just like the instruments on the dashboard of your car, performance measures provide information on a timely and ongoing basis. It's real-time information. So, with the other evaluations that Hallie was talking about, sometimes you wait months and years to get the information. Not so with performance measurement. Performance measurement is real-time. It's given to you in time to take action, to take some corrective action if that's needed, okay? And the other aspect of performance measures is that they reflect program objectives. So with that, and if you'll bear with me with this car dashboard analogy, I'm going to give you, ladies and gentlemen, the theory of performance measurement. And let's just focus in our little mental exercise on the engine temperature indicator of your car, okay? We use this to explain how the theory of performance measurement. So you have this engine temperature gauge on your car. You're driving along, and as long as, you occasionally glance at it, and you know that as long as that little dial doesn't slip into the red area of your of the engine temperature gauge, you're fine. Now, what is that red area? It's a standard, okay? It's a standard that's been developed by the car manufacturer. They know that if the engine temperature exceeds blah, 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 that the engine integrity is in question. So you have to do something. So we begin with establishing some sort of standard, and you have some sort of indicator to tell you whether or not you've passed that standard, okay? Fine. So, this may have happened to you. It certainly has happened to me. You see that engine temperature gauge go into the red, okay? So what do? Well, you know that you have to take some kind of corrective action, okay? There's been a deviation from the planned level of performance. It slipped into the red, and you've got to take some kind of corrective action. Well, probably the first thing that you've got to do is stop the car and let the engine cool down. And then you'll follow that up with some other type of corrective action. You'll take the car to the garage, and they'll fix the radiator, maybe the fan. You may just be low on coolant. Who knows? But you take it to the garage, and they take some corrective action. And this corrective action will bring the car back up to its planned level of performance. So you get the car fixed in the garage, you turn it on again, and sure enough, the engine temperature gauge stays out of the red. So that, ladies and gentlemen, is the theory of performance measurement. You establish a goal or standard, detect any deviation from that planned level of performance, and then take whatever kind of corrective action it takes. In the case of a mental health court, the theory is just the same. It's establishing goals and standards is a little bit more difficult because in this area it's not well defined by the literature. And what we recommend as we go through this is that you collect data for a while and then begin to establish for yourself what an appropriate goal or standard would be. Now, this is in lieu of literature. You know, the literature on mental health courts is developing all the time, and who's to say that maybe 5 years from now somebody will come up with this, you know, for a program of this size, this is the ideal recidivism rate. So, you know, these will be informed by the literature, but also you guys will collect the data on your performance measurements and begin to define for yourself what an appropriate level of performance is for the court. And any time that you're going to be collecting this data on a regular basis, monthly, quarterly, or whatever, and any time, say, your graduation rate dips below what your standard is, then you go back and you take a look. What do I need to do to bring the graduation rate up? What do I need to do to reduce the recidivism rate? This, ladies and gentlemen, is the theory of performance measurement. So having given you this really deep, intense theoretical overview, let me just describe our development process for these performance measures. 3 steps here. That began with an extensive review of the literature. We convened a panel of performance measurement and mental health court experts for advice and review. We had some representatives from the Council of State Government. Some of you are familiar with Doug Marlowe, who has participated in this, and we had representatives from the Brooklyn Treatment Court and the Mental Health Court in Brooklyn and others, a really good array of experts. And finally, we pilot tested the measures at 4 sites, and we're very, very, very pleased today to have Lynn Fenton from Orange County, California, who will describe her court's experience with the mental health court performance measures. And with that, what I would like to do is I'm going to provide you with a sort of a broad overview of the first 8 performance measures. And then I'm going to hand the ball over to my colleague, Dr. Nicole Waters, who will describe the remainder of the measures and give you sort of an in-depth look at 3 of them in particular and show you some of the tools that were developed by this project to help you with this performance measurement job. And let me add this, your court may or may not be ready for evaluation, but every mental health court should be collecting performance measurement data, just like you need to keep your eye on your car on that set of indicators. So having said that, I'll get off my soapbox and just go over these measures. In the participant accountability measurement domain, we had 3 measures: in-program reoffending, which is based on arrests, attendance at judicial status hearings, attendance at scheduled therapeutic sessions, and in the next measurement domain, which is social functioning, we had 1 measure, living arrangement, which is the percent of participants who changed from homeless to not homeless during the course of their participation. Finally, for me, in the case processing measurement domain, we had 4 measures. Retention, which describes how participants exited from the drug court, what percent exited by graduation, what percent exited by termination, what percent exited by voluntary withdrawal, etc. Time from arrest to referral, and we recognize that this measure, arrest to referral, the court only has a limited amount of control over this. Nonetheless, we know that the sooner that you get participants into treatment, the better the outcome. So this is important to measure. And it may be that the court may need to take collaborative action with other agencies like the police or probation to reduce this time. So it's important to measure even though it's not completely under the control of the court. Time from referral to admission, which is the court exerts greater control over, and total time in the program. So with that, I will turn it over to my colleague, Dr. Nicole Waters.
Thank you, Fred. 2 of the performance domains that Fred covered, participant accountability and case processing, are fairly straightforward and appear in many other performance measure sets, such as the National Center for State Courts court tools. Those are developed for general courts. The performance domain that I have listed here, collaboration, has not typically been included in performance measures, but it is important to problem-solving courts and the nature of interagency collaboration that's really inherent in these programs. So within this performance domain, there are two measures. Measure 9, which is team collaboration. Team collaboration is assessing whether or not information is available and in a timely manner to the mental health court team. So sharing information across the team members. Measure 10 looks at agency collaboration, which specifically looking at the law enforcement agency and whether or not there is timely notification to the mental health court as to whether or not a participant who's in the program was arrested. Another performance domain that is fairly new to performance measures is the individualized and appropriate treatment, as you see here, measure 11. However, this performance measure, while it may be new, has the strength of evidence-based research behind it. It's actually one of the few that has very strong research using this risk and needs responsivity model. The purpose of Measure 11 is to effectively align participants' diagnoses and criminogenic risks with treatment and service dosage. This measure will provide courts with an indicator of whether the resources for supervision and treatment are correctly allocated to those who are in need. In other words, if the needs and risks of the participant are the highest, then the court is responding in kind with the highest levels of program intervention. So as you can see on the screen, functional impairment on the left side between low and high on the matrix, the 2x2 matrix, and criminogenic risk along the bottom in blue, from low to high. This particular measure looks at whether or not participants are receiving the treatment and supervision according to their assessed needs, so you would assess them, assign them to the different quadrants, and then determine whether or not they are receiving the supervision and service that is indicated by their assignment to different quadrants. Procedural fairness is a concept that was developed by Tom Tyler, and he predicted and studied this with empirical research and found that the outcome of particularly a case is less important than the procedures used to arrive at the outcome. So the performance measure number 12 is the participant's level of perceived justice, and that is expressed in a 5-question survey. I've listed the questions here for you. These would be given to the participants as they exit the program and gives you an assessment of whether or not they perceive the procedures to be fair. The final performance domain deals with aftercare and post-exit transition. Measure 13 assesses whether or not the participant is prepared to transition away from court supervision. The participants should be able to identify different sources of assistance, such as housing, medication, mental health symptoms, medical problems, and if it's applicable, if they have a co-occurring disorder, substance abuse, where they would go if they needed assistance. The final measure is Measure 14, and that's post-program recidivism. Measure 14 determines the incidence of post-program recidivism, and it's defined as a conviction on a new charge after the participant exits the program. So these 14 measures make up the complete set of performance measures for mental health courts. What I'd like to do next is to discuss and demonstrate 2 different tools that we've prepared to help facilitate you in the courts to implement these different performance measures. The first one that I'm going to talk about is an Excel-based template that should produce graphical outputs in the form of reports that you can use. The second product is an implementation and user's guide. This will provide you with step-by-step instructions on how to implement these different measures. As an example of the first tool that I mentioned, the graphical reproduction of different output, this will be automatically generated. And for example, I have shown you measure 1, in-program reoffending. What you can see here is an example of some data. The percent of exiting participants with arrest during participation is at 39%. So as you recall what Fred had mentioned earlier, this is your dial on your dashboard. So your 39% gives you an indicator as to how your court is doing. It can also be broken down by type of exit and type of offense. So this gives you a sense of what's going on in your court and will help you to manage. Another example that I will show you is that you can click on the data graphics template. You can find this online, or you can find it through, we also have a CD-ROM where this is available, but you can simply click on this or download it from the internet, and it'll provide you with an Excel spreadsheet. The first sheet you would see is an input screen. You will enter your data into the different orange cells. So as you can see, the participant's name, John Johnson. You can assign this person to a particular quadrant, as I talked about before with Measure 11, the 2x2 matrix. So John Johnson is assigned to quadrant number 1, and then identify the number of supervision contacts and the units of service. The Excel spreadsheet will automatically generate for you the different formulas. And as you'll see here, the graphics will be automatically reproduced and put into the form of a report that you can print or you can edit. The top half of the report simply reports back summarized data from what you entered. It gives you the summary for the four different quadrants, 1 through 4. It also lists the number of participants. It provides you with average units and the percent of participants who are above the average for supervision and for service. So looking at this graphic below with the bar graph in the bottom of your screen, if I were to ask you, what do these data tell you about this example court? You might recognize that quadrant 2 and quadrant 4 are the ones that are highest in functional impairment. So along that matrix, those are the 2 that were high in functional impairment. So what you would expect to see is that the orange bars are going to be the highest for quadrants 2 and 4. And they're highest in service because that's related to functional impairment. Likewise, you can look at the graph and see that quadrants 3 and 4 are those who are assigned to highest criminogenic risk. You would also expect then that they have the highest supervision contacts, and the blue bars in quadrants 3 and 4 are likewise both among the highest. So what you can see from this graphic is that our example court is wonderful. That it's following exactly what we had expected. 2 and 4 are high in the orange bars, and 3 and 4 are high in the blue bars. But this template will allow you to diagnose what's going on and to give you a feedback that's real easy to see in a visual format. You can print this information, provide it to the judge, provide it to funding agencies. You can provide it to program coordinators, managers, whatever is useful for you, even your team members. As I mentioned previously, the second tool that we have provided is the Implementation and Users Guide. This is a document, again, that you can receive through the CD-ROM online, and we can also take requests to mail you a hard copy, but it provides step-by-step instructions for the course. A key feature of this is that we have a section called User's Notes. So here's an example from Measure 13, and it's an excerpt from that measure's user notes. If we go back to the poll results, as Fred mentioned, most of the attendees of this webinar have 59 or fewer participants in their program. If any of you are in programs that are very high volume courts, you may want to consider some of the challenges that we saw from our pilot sites. The pilot sites were able to give us feedback from their experiences implementing these measures. And one of the points that we received as far as feedback was that sometimes the exit surveys can be very difficult when you have high volume participants. They're exiting the program, and it's very difficult to survey each and every one of them. So some suggestions are listed in the user's notes that provide ideas and step-by-step instructions about how it is you could sample if you're doing your exit surveys. Another component of the user's notes is providing you with additional resources. This is for you if you would like to learn a little bit more about each of the measures. You can do some additional reading, and these are the references that are provided. So next, what I'll do is I will turn this over to Lynn Fenton. She is one of our esteemed colleagues of the Superior Court of California, County of Orange, and she was an extremely valuable resource to us as a pilot site. As we have mentioned before, we tested these measures in 4 different sites across the country, and we asked each of them to implement these for a 6-month period. So she and her staff have implemented these measures for 6 months, and she's going to discuss some of her experiences. We tapped into their experiences and asked them for feedback at the end and the conclusion of those 6 months during a focus group, and we implemented a lot of those changes and those responses that they gave us into the final product. So I will turn this over to Lynn Fenton to discuss some of her experiences.
Good afternoon, all. I wanted to say thank you very much for allowing Orange County Superior Court to participate in this webinar and for us being able to share our information with you. First, I wanted to establish that we have a very good collaboration with our teams that support our mental health court. For us, that is very, very important to get the collaboration established up front, to have a clear understanding of what we're going to share with each other and how important it is to be able to share. So our agency interaction starts from the moment we conceive of a new court program, and we start working together as a team from that point forward. During the evaluation portion, while we're considering a person for participation in one of our mental health courts, the healthcare staff obtain a waiver from that participant so that they are able to share information about that participant. That waiver allows us to have the knowledge of what's going on health-wise with that person, so that if there are issues that need to be addressed that maybe someone else on the team can assist with, we're all at the table. Every one of us has that information. Individuals are discussed in pre-court staffing, and prior to that, we prepare a progress review. That is actually jointly prepared by several of the team members, most importantly, the probation officer and the healthcare therapist provide input for this progress review. On this review, we're given information such as living arrangements, entry into residential treatment, current diagnosis, program non-compliance, any non-compliance issues, and a sanction history related to the non-compliance, and other current issues that are going on in their lives. For instance, education, achievement, like obtaining a GED or their diploma, job search, a new job that they obtained, a new baby being born, something going on in their lives, other things like that. That's contained on the progress review, but then it's enhanced by discussions in the team meeting so that everyone at the table in the team is aware of what's going on with these participants prior to even walking into the court. The person who does our data entry for us uses the progress review and notes that they take during the sessions to obtain the data. So we don't go back to the different agencies after the court session or 6 months down the road and say, can you give us how many drug tests you did or how many dirty tests were obtained on a particular participant or how many treatment sessions they have attained. We look most importantly at what's happening then and now, and we input that data immediately so that we've got information that's current and that's flowing, and also that it's simple and takes little time to input. We try to keep the data entry moving as quickly as possible. And I'm going to turn this back over to Nicole.
Thank you, Lynn. I just wanted to mention that if you have additional questions, which I see some of you are writing questions, such as how are we calculating certain measures, the full calculation is available through some of our products. And you can go to ncsc.org/MHCPM, where you can download all of the documentation. If you prefer, you can also request a CD-ROM directly from us. Both myself as well as Fred are willing to ask any questions you might have. So with that, I will turn this over to Hallie for some concluding comments.
Great, thank you. And I just want to maximize the time that we have for questions from the audience. So I'll go through this very quickly. The next two slides are really just to give some perspective on the conversation we had so far. So we've been talking about mental health court performance measurement. First obvious question, well, what makes it a mental health court? Those of you who are familiar with the mental health court essential elements publications will recognize a lot of the flavor of those elements in the measures Nicole and Fred talked about. And you'll also recognize a lot of the variability that goes into making the mental health courts that are probably represented on this call right now. So I just wanted to pose that question for the group. The next question is one of performance. So which performance are we measuring? Which dashboard are we looking at? The operation of your program is existing in the context of a lot of other programs that also have performance to be measured. So there's performance measurement for your federal grants if you're a JMHCP recipient, for example. There's performance measurements that you might be required to report for your state or local government, and then also for your criminal justice and behavioral health systems. So just wanted to highlight the fact that the performance measurement we're talking about today is occurring in the context of more measures and more data collection that's important to how well your program is serving the community and serving the goal that you set it up for, without making it too overwhelming. Just to consider thinking about the measures that are important for your funders and your other stakeholders, as well as the people who are outside of your program, but an important part of your system. We'll do that in the next webinar. Just to summarize quickly resources that are available to you, these are some of the website links that I mentioned before, and just for those of you who are interested, the webinar slides and the recording will also be available online afterwards, so you don't need to write these down very quickly. Finally, those are the national resources. I also wanted to point you out to the resources that exist in your peer programs. The Consensus Project maintains 2 opportunities for contacting your peers on our website, consensusproject.org. You're looking right now at a picture of our local programs database that contains self-managed entries for programs around the country. So you can sort and look for programs that are in your state, programs that have similar keywords to you. I've also got a nice flashy yellow arrow there for you to sign up for our newsletter so you can hear about other programs that are going on and other activities like this one. We also have a new feature, the discussion forum. That's the link that's on the top right-hand corner of the slide. That's an opportunity for posing and answering questions peer-to-peer. We also have some experts who are staffing the forum. So really encourage you to use that as another place to interact with each other, to interact with the experts, and learn from each other. So I wanted to thank you all again for joining us. I'm going to open it up now to questions and answers with our presenters. So to ask a question, there's a question and answer panel in the bottom right-hand corner of your screen. Right below the panel is a place for you to type and hit the send button. As those come in, Sean, who's done a wonderful job emceeing this, will route them to me, and I'll ask our presenters. So I'll encourage you, if you have a question right now, to start typing it in. We'll get to as many of them as we can, and also try to, you have the contact information for everybody who's presented today, and so you can follow up directly afterwards if you were not able to answer your question. All right. I'll start out with some of the questions that came in during the presentation itself. This is a question for either Nicole or Fred. Can you talk a little bit about how you define recidivism in your measure? So was recidivism defined as rearrest, booking, conviction?
Fred, I'll let you take that one. Or maybe he's not listening. So
I'm sorry. Yes, let me just hit the mute. We have two reoffending measures. The in-program reoffending, which is in the participant accountability area, and then we have the more long-term post-program recidivism. And actually, the standards are different for both of those, and I'll try to explain our rationale behind that. But the in-program reoffending, what we're looking for are arrests that result in the participant being formally charged, okay? So that's kind of the threshold there. The person's arrested, but the threshold has to be that they were at least charged, okay, formally charged. Now, on the other hand, with our post-program recidivism, what we're recommending is to track participants for up to 2 years after they exit the mental health court. And the standard there is an arrest that results in a conviction. So the standard's a little bit higher on the post-program recidivism. Now, why the different standards? Those of you that work in the area of problem-solving courts know that there really is there yet has to emerge a generally accepted standard for what the best way to measure recidivism. But I'm drawing on, I think, what some of the best informed literature has to say about this. And with the in-program reoffending, we think it's more important to get the information in a timely way to the court. So, rather than waiting to see whether or not a conviction ultimately arises from an offense that occurs while the person is still active in the program, we think it's important for the court to know that this person's been arrested. So, that's a case management issue. So we set the standard there. We didn't just stop with arrest. We had that the arrest had to result in a charge, so that we do have, some sort of threshold above arrest. But it's just not as high for the post-program recidivism. Now, with the post-program recidivism, we decided on conviction as the standard there. Because, with this one, I think the timeliness is not as crucial as it is with the in-program reoffending. And to really get a true picture of recidivism for this type of program, you want to cut out all the junk. So we set the standard high, conviction, to give us the best picture with the highest threshold for post-program recidivism. And that's all I got for you.
That's great. Thank you, Fred. I have a question for Lynn. What were some of the biggest challenges and surprises that your court found from implementing the measures?
Well, I believe the biggest challenges that we had was kind of some of the way we have been measuring the standards, and we kind of had to go back and tweak it just a little bit, or look at how we were looking to get the data that we were collecting. For instance, one area in particular is we really only look at the number of dirty, diluted, or missed tests as opposed to the total number of tests that are given versus how many dirty, diluted, or missed tests. And we found that we don't have a really good way to collect that unless we get the probation department and healthcare to provide us their number of tests that they're giving. So that was just a little bit of a change in the manner of receiving information. And basically, I don't think there was anything else that was a surprise to us. It was just good for us to put it into all of the data that we've been collecting, put it into a reasonable format so that we could take a good look at how we're doing, how we're affecting our court.
Great, thank you, Lynn. And for Fred and for Nicole, there's been a couple of questions about getting more feedback from the pilot sites. Is there any way that participants on the webinar can learn more about what the pilot sites are doing?
Yeah, actually, the implementation and user side, as I said in the one example from Measure 13, there's user notes. So you can really see quite a bit of what their experiences were. If you want to contact them directly, feel free to go through myself or Fred, and we would be glad to pass along some contact information as to how to get more specific feedback. I'll also open it up to Lynn to offer her contact information if that's in her best interest too.
That's fine for me. My contact information is L. Fenton, F as in Frank, ENTON, at OCCourts, COURTS.org.
Great, thank you. And Nicole, there have been a couple of questions about how to receive copies of the materials. We should be all looking at your website right now, and if somebody wanted a hard copy, what should they do?
They can request them directly through me or Fred. Our phone number and email is listed in that previous slide that you should be able to access. And simply request it through us, and all the materials are free. So we'd be glad to share that material with you.
Super. Fred, I had a question for you about your dashboard analogy. There's a question about, that there's a green zone and a red zone, and how would a court know whether their numbers are in the green zone or the red zone for a specific measure?
That's a very good question. I appreciate it. Basically what this entails is establishing a performance goal or some sort of standard, okay? Now, as I mentioned, this is kind of the tricky part about performance measurement. I mean, the literature in this field is still very much developing, so I can't tell you right now, based on the literature, based on the research, what a acceptable graduation rate is. I can't really tell you what a good or bad recidivism rate is. That has really yet to be defined by the literature. I think that the guidance will eventually emerge in some of these areas, but it's just currently not there. So, keep reading the literature, and be aware of what's going on there, because I think some of these standards will emerge eventually. But, in lieu of these kind of standards, what can the individual courts do? Well, this is what we recommend, and the situation is similar with drug courts, where I've done a lot of work in performance measurement. We basically recommend that the courts collect data on these performance measures, collect them for a couple of years, and then start to just define for yourself, what is we've got 2 years worth of data. We see how our graduation rates change over time. What is our goal for a graduation rate? Based on the data that we've seen, what is an appropriate graduation rate? What is an appropriate in-program reoffending rate? do this in a empirically based fashion. Look at your data and define for yourself what you think an appropriate rate is. Again, in lieu of the literature. If anything emerges from the literature that can help you to set these standards, that's what you should do. But if it's not there, collect data for a couple of years and begin to define for your court what an appropriate standard is. And that may change over time. Eventually you may say, well, we think an acceptable graduation rate is 33%. And then, you're doing good, you're hitting that goal every time, and you say, well, let's up the ante, let's see if we can make it at 38%. It may change over time. My point is, don't set the standard arbitrarily. I've seen people do this. It only causes headaches. Rather, look at the data, collect data for a while, and then begin to define the appropriate standard, which will define the green and the red zone. If you decide for your court, then appropriate graduation rate is 39%. Then if you get below that 39%, you're in the red zone. If you get above it, you're in the green zone. You're good, and you may need to go back and set your standard. So that's my answer to that one, and that's a good question.
Great. Thank you, Fred, and thank you, Nicole and Lynn. I see that we're at 3 o'clock, and before people begin to disconnect, I'm going to tell them about how we're actually in the middle of another performance measurement exercise in the sense that we'll be measuring the performance of this webinar, There'll be a short survey that pops up at the end of the webinar asking for your experience, and we really appreciate if you take a couple of seconds to fill that out so we know what you found helpful, how bad the technical difficulties were, and can also let our presenters know what a wonderful job they've done. So thank you all for your attendance and participation. Thank you again to Drs. Fred Cheeseman and Nicole Waters at the National Center for State Courts, to Lynn Fenton at the Superior Court of California, County of Orange, for their presentations today. Again, please take the time to fill out the survey. And as we said throughout, we'll be emailing a recording of this presentation after the event, and the recording will also be available online in a couple of days on our website at www.consensusprojects.org. Thank you all very much.